Hello guys, in today's video I'll be talking about diabetes in pregnancy and all you need to know. Join me from the beginning to the end of this video to learn all you should know about this condition in pregnancy. Diabetes mellitus in pregnancy is type of diabetes that develops during pregnancy. It is characterized by high blood sugar levels that occur for the first time during pregnancy and usually resolves after giving birth. So this type of diabetes has not occurred prior to pregnancy, but it is occurring now in pregnancy for the first time. And one thing about this gestational diabetes that it resolves after pregnancy. So that's why it requires management, a specialized management for both the mother and the baby. It is not something that you can manage on your own. It requires specialized health care. Gestational diabetes occurs when the body cannot produce enough insulin to meet the increased need during pregnancy. This results in elevated blood sugar levels, which will be dangerous for both mother and the baby. Why the exact of this cause of this diabetes mellitus is not fully understand, but we know that hormonal changes in pregnancy can contribute to it. That is, placenta hormones are the key factor in this condition. Risk factors: overweight and being obese. These are the things that put you at risk. Having family history of diabetes, older than 25, have had baby that weighed more than 9 pounds, having PCOS, and belonging to some ethnic groups that are predisposed to these conditions. Example, the African American or the Asian countries. So these are the risk factors. Then most women with this gestational diabetes do not experience any symptoms. That's why your prenatal care and visit is very vital. So this condition usually begins at from 24th and 28 weeks of pregnancy. What are the complications to the mother? It can increase your chances of having preeclampsia, high blood pressure, need for cesarean because of big babies. Women with this gestational diabetes are at risk of developing type 2 diabetes later in life. So these are the all complications it poses on the side of the mother. It improves all this risk to you. That's why this condition should be treated with the help of a specialist. Complication for the baby: excessive weight gain, which can lead to shoulder dystocia during delivery, and obesity and type 2 diabetes on the child's side. Then babies born with this gestational diabetes have low blood sugar level shortly after birth, which can pose them to have respiratory distress syndrome and even jaundice. So women that have these things, their babies are predisposed to these conditions later in life or during birth. What are the management? The first thing is dietary changes, regular physical activity, exercise a lot. So you monitor your blood sugar and sometimes insulin therapy. If your blood sugar is consistently high in that pregnancy after 28 weeks, they will place you on insulin or hypoglycemics. Then close monitoring throughout the pregnancy to ensure the well-being of both the mother and the baby. After delivery, blood sugar supposed to return to normal, but some women continues having this blood sugar, which leads to type 2 diabetes later in life. So that's why monitor your sugar levels even after birth. Additionally, women who have this gestational diabetes are at risk of developing it in future pregnancies. If you have had it in your first pregnancies, that there is tendency that you have it even in your second, third, or any amount of pregnancies you have. So this diagram illustrates a woman's blood sugar, high blood sugar level in the mother, leading to extra glucose to the baby, which makes the baby to add excessive weight.